So we're talking about congestive cardiac failure in pediatric patients. This is for pediatrics. This is going to be a quick 6-minute video just covering congestive cardiac failure. So congestive heart failure, or heart failure in general, is when there is a metabolic imbalance where the cardiac output is not enough, does not meet the metabolic demands of the body. So the cardiac output of the heart is not sufficient. It's a pump failure. Heart failure, always when you think of heart failure, think of pump failure. It's a failure of the pump. And remember, this pump is contracting and pumping blood to meet the metabolic demands of the body. In case in which the pump is not strong enough, in a case in which there's some sort of defect, congenital cardiac defect, for example, which is common in these pediatric patients, this pump will not pump enough blood to meet the high-power demands of the body, and that is what is heart failure. What are the key differences between left and right heart failure? Left heart failure always leads to left for lung. Left starts with an L, so does lung. Left heart failure always leads to lung pulmonary congestion, whereas right heart failure always leads to a problem with liver and systemic circulation. So pulmonary congestion occurs in left heart failure, and in right heart failure you have systemic congestion, peripheral edema, and you remember just there's a build-up in the SVC and the IVC. If there's a build-up of pressure in the superior vena cava, you're going to get jugular venous pressure elevation, and also inferior vena cava will lead to that hepatomegaly. What are the clinical features of congestive heart failure in kids? Now, this is different. The patient won't present with as overt signs and symptoms as an adult. Remember, the heart failure and heart symptoms are always different in kids. They'll have poor feeding for PF, tachypnea, which is a high breathing rate at more than 60 breaths actually per minute. Then they'll get activity intolerance, which means that they'll get very tired when feeding. So babies, babies actually exert a lot of calories when they're feeding, and that is known as activity intolerance, pallor, weak pulses, and cardiomegaly. Your investigations of heart failure in kids will be an echocardiogram, an ECG, and a chest X-ray. You'll also see an elevated HbNP. HbNP rises due to stretching of the myocardium. Your treatment is going to be digoxin. What does digoxin do? It slows down the heart rate and it improves the myocardial contractility. And improving the myocardial contractility will help that pump contract. You can also use diuretics and furosemide to help with that edema, whether that's peripheral edema or pulmonary edema. And you can always use ACE inhibitors to prevent cardiac remodeling, and beta blockers as well, to help with the inotropy of the heart, of the contraction. These children always have poor feeding, so you want to also increase their feeding, make the feeding easier by giving them nipple feeding with enlarged opening, as well as calorific foods and calorific milk. Remember, the heart failure is causing the primary symptom, the primary problem in heart failure is due to hypoxemia, which is mixing of the unoxygenated blood or deoxygenated blood with the oxygenated blood, which leads to lack of oxygenation of our extremities, of our limbs, of our muscles. That is going to lead to a compensatory mechanism which is known as polycythemia. When the O2 drops, our red blood cells are increasingly produced, which is known as polycythemia, which helps with that hypoxemia, low partial pressure of oxygen in the blood. The symptoms of hypoxemia include cyanosis, which is bluish discoloration of the skin and mucosa, clubbing, dyspnea, and tachypnea, which is a faster breathing rate and shortness of breath. Signs of heart failure in small children always include tachypnea, tachycardia, hepatic enlargement, and peripheral edema. So this is everything for heart failure in a pediatric patient. Thank you. Until next time.